So I'm going to talk about the RAPID-TnT study. It is a study of high-sensitive troponin in the management of acute coronary syndromes in emergency departments. This was a study that we performed in Australia in 4 emergency departments between 2015 and 2019. So the question we've had for a long time about high-sensitive troponin was whether or not it actually does improve care and outcome. For many studies that have validated the use of these agents, we've not actually had patients prospectively managed under the high-sensitive troponin information. That we've actually just correlated the troponin levels with their outcomes, whereas the care by clinicians has been up to clinician discretion without necessarily knowing the troponin results. There have been previous cluster randomized studies, but this was the first study that actually tried to put high-sensitive troponin into a 1-hour protocol as based on the European guidelines, and then randomize patients to either a standard protocol or a 3-hour protocol. You can imagine that's kind of hard to get 2 protocols happening in an emergency department, but we did do that, and this was, we felt, the only way that we could tell whether or not using the information of high-sensitive troponin built into a 1-hour protocol actually improved the care of patients, changed the outcome of patients, and influenced whether or not they got different tests. So in this study, we randomized 3,378 patients, and then we had a few discontinue that or withdraw their consent. And so we actually had a total of 1,642 patients in a standard protocol arm and 1,646 patients in a 1-hour protocol arm. What we saw was, in fact, that overall the event rate for all of the patients was about 1%. So that there was no difference in the outcome of patients who were managed under a 1-hour protocol versus a 3-hour protocol. What we also saw, more importantly, was that 72% of patients in the 1-hour arm received a recommendation that they could be discharged from the emergency department, and the event rate in those who were discharged, the event rate being 30-day death and myocardial infarction, was very, very low, around 0.3% to 0.4%, depending on the subpopulation you're looking at, but a very, very safe group. We did, however, find that patients who had newly identified low-level troponin elevations had a higher rate of coronary angiography and a higher rate of coronary revascularization. And together with this, there was a numeric increase in the number of patients who had myocardial injury and myocardial infarction. We adjudicated all the events based on the 4th universal definition. So what we think from this study is that it is safe to implement a 1-hour troponin protocol using the high-sensitive troponin assays. We use Troponin T in this study. And when you receive a discharge recommendation, we know the event rate in those patients is very, very low, and they can be safely discharged from the emergency department with probably a very low rate of needing subsequent cardiac testing. However, in those patients who have a newly identified elevation in troponin, we probably need better ways of managing them, and potentially not all of them need aggressive angiography, and maybe we need to explore other strategies such as CTCA for these patients.